Good morning, everybody, and welcome to another episode of the Raad Life. One of the things that you guys who have been following the show know is that we have a somewhat of a strong concentration of topics relevant to baby boomers, aging, seniors. And one of the things that is really impacted right now is how to care for seniors. Like we had an amazing amount of need when it comes to senior care, and we were always kind of like strained as far as resources. And there are people out there that do this on a daily basis, and they now have had to like face the different reality. Like, can you be around seniors? How do seniors that go to adult daycare basically or senior care during the course of the day, where are they now? Who's caring for them? So I couldn't think of a better person to bring in to talk about this topic other than my good friend Fredy Dominguez, who is very involved, has been involved for a long time. For as long as I've been involved in the senior care industry, he's been involved. And I want to find out from him how he is continuing to do his job at Attentive Daycare, as well as continue his efforts of networking the senior caregiving industry, which he used to do through his networking events that he held in different parts of Orange County. With that being said, I will bring Fredy on right now, and he's in the green room, and let's find out from him what's going on. From what I hear, it's pretty challenging right now in that field, and it's a much needed thing because seniors are under normal conditions susceptible to isolation, and now we're basically telling people they have to socially isolate and socially distance. So with that being said, let me bring Fredy on. Fredy, are you there? Fredy.
Hey, good morning.
Hey, Fredy. Good morning.
Good morning. How are you?
Good, buddy. So I was just saying to set this thing up before I brought you out of the green room, is I was saying that, under normal conditions, the senior industry is challenged. The need is high, and we are constantly trying to find ways to basically better serve the community. And you, my friend, have been involved in this as long as I know, and I've been involved, and you've been doing it from both the perspective of a professional provider of service through Attentive Home Care at the moment, and then also as a networker connecting the community together through your events that you hold in different parts of Orange County. So you, from what I have seen in the last couple of weeks, have been trying to continue to do that. And I want to find out from you what you're facing, what you're experiencing, what people are telling you, like as far as when it comes to seniors and caring for seniors. What is the reality on the lay of the land right now, Fredy?
Well, the industry completely changed at this point because there were, number one, all the hospitals, skilled nursing facilities, and assisted livings with most of the referrals that come in for the whole industry in general depend on. So it's a client has surgery, they need home health. They're going to go home. Well, it comes from the hospital. So the home health companies, the hospice, assisted livings, home care companies, even skilled nursing facilities, all of them are closed. So the people that do outreach networking, they cannot access those resources, those social workers, case managers, doctors.
Right.
So it is a challenge right now because most of them, they're either working from home, they're not going anywhere, driving around. So as me personally as hosting the networking events, the people came into the networking events. I had 2 or 3 a month with 50 to 100 people, depending on the date of the location.
Yeah.
So now I have to figure out a way to keep those people connected. So I had to take use of social media in general, Facebook, LinkedIn, but also Zoom meetings. So I'm doing also the networkings that I was doing in person. Now I'm doing it through Zoom with different speakers. I do it every Thursday from 11:30 to 1.
And how has it been? I mean, what are some of the things that you're hearing from people that you're connected with?
They are well, a lot of people are scared. They have no idea what's going on. Many people have lost their jobs. Other people are working part-time. So it is a big shakeup of the whole industry in general. It is.
How is it? You were telling me that in some there we already even have some cases where people have been either thought of as being having contracted it or basically have contracted it and that are in assisted living right now. Yes.
Yes, there's few assisted livings here in Orange County. Well, specifically one that already has a couple cases, and then the client was sent back from the hospital, and so there one assisted living there, the patient is there.
Mm-hmm.
On Friday, I got 2 text messages from 2 skilled nursing facilities, new ones that they just got. Each one got a case. Also in Riverside, Inland Empire,
Mm-hmm.
there was, well, last week there was one skilled nursing facility who had like 50 something cases, and then one was for a case like that.
Wow.
This one up in Myrtle Beach, she's been struggling for weeks. That one has right now. That was
And how are you? I mean, right? And I was talking earlier about the fact that under normal conditions, seniors are susceptible, are in danger, basically, a vulnerable population to isolation and physical distancing as part of we deal with this. So this is, I would think, even more of a hard hit for the senior industry because some of these people basically were dependent on that like Meals on Wheel delivery, that human contact situation that we talk about all the time. That it's
but
more than just the meal, right? So what's
yeah,
going
but
on with that?
well, at least Meals on Wheels, basically the client, the person that comes in, the driver doesn't have to contact the client. So that's basically, as long as you disinfect the food, the container and that, there's fine because the food comes prepackaged.
No, I
The
understand,
issue,
Freddie, but are
yeah,
they still? I mean, I'm assuming they're still delivering, right?
yeah, they're still delivering. No, no, definitely. They're even delivering even more now at this point because there's a lot of seniors that need even more services than before.
Yeah.
I was talking to Susan, and she wanted to be in the networking meeting, the virtual networking meeting I did.
Yeah.
She said, no, I can't because she's was also delivering meals. So they're actually at this point, they need even more volunteers to help with that.
No.
In our case, as a caregiver provider, then it's a completely different setup because we already have our clients and each client has their specific caregivers.
Mm-hmm.
So we make sure we train our caregivers. Well, they were already trained in and safety and everything, but now even before, uh, so now what we did, we created a safety packages.
Mm-hmm.
Uh, so we deliver to each caregiver 3 masks to each one of them to make sure, and then gloves and lock sheet and all that. Also to keep a log of who comes in and who comes in the house,
Mm-hmm.
to make sure that the seniors are as isolated as possible. When the caregivers come in, to make sure that they wash their hands before, well, if they're gonna take care of the client, put a mask on, and then wash their hands after, and make sure that everything is uh, basically clean and sterilized.
Well, and are you're not taking on any new clients, are you?
We are taking new clients.
Okay.
We do still we're business as usual at this point. The only clients that we're not taking at this point if they are basically tested positive. If they tested positive, we are not taking at this point until they test negative twice. Then definitely we'll be able to take.
And
But
and let's make sure that people know what we're talking about here. So I'm going to put up your
yes,
logo and your website. So it's Attentive Home Care, attentivecare.com. If you guys are interested, reach out to Freddie. He'll let you know. But this, I mean, I'm sure that this has also changed your protocol as far as admitting and processing
yes,
all this stuff, right?
definitely. So before whenever we had a new client, we went in and met with them in person at the hospital. Usually, whatever the client was at.
Yeah.
Oh, well, now we're done. We do basically everything with via either social media, virtual or video conference, or any way possible that a client can meet with us. So through video, especially to see exactly what the needs are for the client, if they can stand up, how much care they need, and everything.
Mm-hmm.
And then we address the situation and schedule the time for the caregiver. If they want to interview the caregiver, we can set up the caregiver to come in for
Mm-hmm.
an interview, and then also, but make sure that the caregiver doesn't have any symptoms or any issues, and is a qualified person that will be
Mm-hmm.
able to take care of the client.
So, what do you foresee that this is going to change after we're through this? That this is going to change the way that you guys are conducting your business? Is it going to change? Is there some things that you're learning now that you will be applying regardless?
Well, definitely it's going to change a lot of things. As I mentioned earlier, it's changing the industry in many ways. Most people are moving towards more social interaction, virtual media, virtual interactions. So yes, it's going to change in that way, but at the same time, uh, a lot of business have to change their policies in general, and how they're taking care of the clients and how they do business. So
Mhm.
I don't know exactly at this point. I think if I'm telling you I know this is going to happen, I would be lying. But at this point, I have no idea what's going to happen,
Yeah, no, that's
honestly.
that's actually very right on, Freddie. I had a gentleman on who was an economist yesterday. We were talking about the fact that he basically said, and in his case, he was referring to data, right? He
Uh-huh.
said that anything that you see in the next 90 days, you should just put an asterisk next to because it means nothing. It's like,
Exactly.
yeah. You're right on. Like we really don't have any idea exactly how this is going to manifest itself afterwards. And again, if we go into next fall, like it's very easy to see ourselves at the end of summer, beginning of fall. Now we've got another, winter season. We've
And
got
it'll come
another
back.
flu
It might come
season.
back.
Might come
Exactly.
back. It may come back different. Where will we
Exactly.
be? What he said is actually like, we need to be in a pretty good position by September. And that's when
Well,
we're going to really know whether we are basically ready or not to deal with what's coming. But right now,
exactly.
you can't figure out what's going to happen. Not
No,
exactly.
and I'm sure if we're gonna bounce back out of this very quickly and easy as soon as they figure out uh, a vaccine or something. But at this point, until then,
Mhm.
or we all create an immunity to it, like any other flu. But until that point, yeah, it is a big question mark.
Well, and is it? Are you hearing from hospitals and things? Are those facilities sort of strained in terms of admissions? Or where are we at? Because I see the numbers constantly going up now, almost on a daily basis in Orange County. But part of it, I'm sure, is the fact that we're testing more, maybe, right?
Yeah, it's because you're testing more, but also too, the but it's not because you're testing more, also too because the numbers are increasing. More people are coming into emergency room. For example, I have a friend on the skilled nursing, well, not a skilled nurse, in the hospital who's a nurse who was very skeptical at first. She said, "No, no, this is all propaganda, social media, everything is just too. They're just basically, uh, they just like going crazy
Mhm.
just for the ratings." Well, that was what she was saying, like around until like 3 weeks ago. Then I spoke to her last week. I said, "So what's going on? Are you still thinking the same?" She said, "Nope. I see cases that more and more cases are coming in. We're almost running out of
Hospital beds.
hospital beds and everything, ICU. Now there's the hospital, there's the San Pedro. The So now what they're doing, basically the hospital comes into their hospital, and then the Navy hospital. So they come in and then
Mhm.
select the patients that they're gonna go take there,
You're
because
talking
they
about the hospital ships. That one is
the
in
hospital ship, yes,
in
correct.
Los
So that
Angeles Harbor. Yeah.
exactly. So they go to all the hospitals to see what clients they're going to be transferred there, because it's 1,000 beds, to open up the hospitals that have the more cases.
Right.
Well,
They're freeing up the local hospitals to deal with the coronavirus, and they're basically
exactly,
moving other
exactly.
patients to the hospital ships. Yeah.
Yes, and then also they trying to send the ones that are better
Hmm.
home or to assisted living, so skilled nursing facilities. But what she mentioned too is she said that it's very uh, the problem with this is that she's seen firsthand is that the patients go home,
Hmm.
and then within few hours or a day or two, some of them come back very critical, and they had to be put in ventilators.
So so
So that's what
so
she was telling.
so there's sort of this testing, but then you think if you're in the clear, and it turns out that
Exactly,
no, actually it's later. Yes.
exactly.
So
That's what she was telling me. So it's, I said, it's from her part, so it's not something that I can
right.
give you 100% information, but that's what I heard.
No, I mean you're getting it from somebody who's on the front lines. I totally get
Exactly.
that. Yeah, I got to tell you, I didn't not take it seriously. I took it seriously, but I was kind of a little skeptical about how much is being blown out of proportions. And regardless whether it is, it isn't, it was, it wasn't, it doesn't really matter. It really has some ramifications and impact right now. We're in it. It's like, and then when I've been hearing from people that I know that are in the nursing facilities and in the hospitals, I'm getting the same thing. I'm getting everything from we don't have enough masks, and it's
Exactly.
still the case 3 weeks later. We're still barely kind of starting to make that happen.
Hmm.
So it's been very hopeful in watching how people step up and do stuff.
No,
And
actually, it is. Let me give you an example. For example,
yeah,
I'm
please.
part of the Rotary Club in the district, which covers Orange County, Long Beach, up to Whittier area.
Yep.
Um, Within few days, they were trying to figure out what to do because what's going on. So they were or they're ordering 25,000 masks and they're going to distribute among the hospitals. But also right now, what they're doing first hand right now, right away, they were able to secure supplies and they're building hospital face shields.
Hmm.
Uh, 30,000 right now. Uh, they did it in 3 or 4 locations this weekend.
Yeah.
Uh, yes, so and those ones are going to go directly to the front lines, to the hospitals, the skilled nursing facilities, assistant livings.
Do you think do you,
And
do you think we're gonna ever not do that? Like all of a sudden, this is the case. I mean, I think we're gonna go through a period even after we have either a cure or an all clear or whatever, that we're gonna basically our the way of dealing with with patients and things of that nature is probably gonna change to some degree or the other forever because of this.
oh, definitely. Well, not only that, because but also now, well, the problem with our society is that we forget so super easy.
Hmm.
It's just the next thing that comes and all that.
Hmm.
And then so hopefully we don't forget about this, and then we really focus on uh, and prevention, because a pandemic can come back at any time,
Hmm.
and that's the problem, that we don't realize that if something like this comes up, we don't have the antibodies, and then so we have to learn from it. If you don't learn from it, then shame on us, because that we're going to be going through the same thing over and over.
And it could be as early as next year. I mean,
Oh,
yeah,
yes.
yeah. I mean, it's you're very very much on. I mean, and people I've had on last week have been we're echoing that too. That this is an opportunity for us to actually look at how we deal with things on an individual basis, how we maintain hygiene and cleanliness, sort of that we take for granted because we live in a country that basically everything's supposed to be safe, but there's certain personal accountability that needs to happen. Uh, the fact that what we cut and what we prioritize, either as a society,
That's the
as
problem.
a
Yes,
county,
exactly.
as a government, that these things you can't cut these things. Like you have to have these safety nets in place.
And that's what happened. There was no preparation for anything. They cut everything out, and they just ignored it until March 17. And when was China? I saw the
January.
news. Yeah, no, actually, even before that.
Before
I
January, yeah, you're right.
Yeah, it was before January. When China, I heard the news about China. They started like around probably December something.
Hmm.
When I started hearing the news that what's going on in China, but nobody really paid attention. Oh no, it's not going to come. The issue is the people think locally.
Hmm.
It's not locally anymore. We're a global society. Within few hours, everything can spread.
And it did.
That's the problem, and
And
that's what happened.
and not only did the virus spread within a few hours, panic, concern, worry,
Exactly.
hoarding of toilet paper. I mean, yeah. I mean, we laugh, but it is an
No, it
indication
is.
of how close we are to that kind of behavior. Like whether
Oh
you
yeah.
needed it or not, you still went out there and cleared out all the shelves with toilet paper. And
Hmm.
and I've said it before and I'll say it again. The funniest thing to me with that story is when Costco wouldn't take the toilet paper back. Like Costco that
Exactly.
takes back everything did refuse to
Well,
take back the toilet paper.
though they had to, because otherwise, imagine how much toilet supply they're gonna have after.
No,
So no,
I think the initial thing was like, fine. You wanted to hoard toilet paper. Go ahead and hold toilet paper. We're going to take it back.
Well, you have toilet paper for the next 40 years.
Listen. Anybody out there who's got extra toilet paper, I tell you what, turn it into a positive. Go donate. Have somebody donate it to, like, once we are able to donate it to a senior center, donate it to some facility that could possibly use it. But
well, and actually, right now there's assisted living, small body cares, or that they don't have enough supplies.
yeah,
So yes, so if you have extra, make sure that you donate it.
you
Otherwise,
contact me or Fredy. We will figure out a way to
yeah,
get it
yeah,
from
we'll
you.
get it. We'll get it to them for sure.
Leave it outside the door. We'll figure out a way to pick it up and drop it off. But if you got extra toilet paper, I can't believe this show has turned into a toilet paper, drive.
Uh,
Hello, everybody. If you have extra toilet paper, please contact me and Fredy, and we will pick it up from you and drop it off to a senior care facility.
yeah, but keep the germs with you. Don't bring the germs with you.
Oh yes. Actually, it has to be an unopened pack of toilet paper, right? So
yes, exactly.
otherwise, we will leave it right there at your doorstep.
Exactly.
So Fredy, okay. So tell me a little bit about how you're maintaining, because I know you deal. I mean, this is a very emotional job to begin with under normal circumstances, right?
Yeah,
It is emotionally draining. We see a lot of things that are, and you see it more because you're on the front lines that are relevant to the care side of it. But how are you maintaining? What are you doing to maintain your ability to be there for people?
Well, it is. You know what? It is. At first, it was kind of challenging in my part because I'm not used to just stay at the office, or personally, and all the news, everything was going on, and then making sure that everything goes well with our clients in general. So yeah, it was challenging, but I'm getting adjusting to it. So, but as a company, as a business, we are all as a team making sure if there's something happens with the client, same thing as always. We have our care supervisors that go in and right away address the issue. But likely at this point we haven't had any concerns or any serious issues, because as soon as we started to plan ahead, and as soon as we saw this coming, we realized, okay, we need to prepare, we need to do this and that, and that's why we were able to order the mask uh, ahead of time. And luckily also for hand sanitizers, look, I have this one that I carry. Well, we have these hand sanitizers that we used to provide. We always provided for, and like for networking meetings and stuff like
Yep.
that,
Yep.
health fairs. So we had 2 cases that we didn't use, and I thought that we didn't have any. We go to the stores and see, hey, we have 2 cases. So
You're
we
a rich man with hand sanitizers, right?
so we were exactly 2 big cases. So that was more than enough to basically give each caregiver 2 of them, because the cases were like big ones. I
Yeah.
posted a picture of a small little case, just to people. So we're able to provide hand sanitizers to all of our caregivers, and as extra, actually, I was able to donate to some people that they needed.
Good for you.
Because I put it online too as well. So we're donated to them, and also we donated some extra masks, the extra N95, the surplus that we had, to some nurses and stuff at the hospitals.
Well, Fredy, I appreciate you taking the time, man. I know you're very busy right now, and thanks for kind of catching us up on what's going on with this.
Okay, one more thing.
Yeah, go
Let
ahead.
me add.
Go
Actually,
ahead.
since right now it's a difficult situation, you might not have hand sanitizers, or you might not have gloves. You can go to the store, instead of gloves, just get those sandwich bags,
Mm-hmm.
those disposable sandwich bags, and then you can use those ones to open doors. So because you can use a paper towel to open doors or anything if you go somewhere else. But also very important too, I didn't know this, I didn't even think about this, but when you go fill out your tank,
Mm-hmm.
that gas pump,
Mm-hmm.
everybody comes in, touches it and all that.
Mm-hmm.
So use those plastic bags, any plastic bag or anything, to make sure, oh, hand sanitizer to clean yourself
Well,
up.
and actually, if you do have gloves, like I bought a box of gloves that I've been using, and it's sufficient for right now, I think. But if you do have gloves, you may want to try to save them by actually using what Fredy is suggesting, plastic, sandwich bags,
Yes.
because then when you need the glove, you have a glove. But in the meantime, like for a gas station, whatever, you can use a freezer bag or something where you get your hand in. And anybody who actually, the other thing that comes to mind right now, Freddie, is also doggy poop bags. Actually,
Oh, that's a good idea too.
because
Exactly.
you could put your hand. I mean, anybody who's got a dog and you've ever picked up the
Yeah.
thing, it's that could be a good protection too. So you could definitely do that. The other thing I have been doing, to be honest with you, and as soon as I kind of grabbed it when I first heard of this, is it's similar to the masks that are fabric masks, right? Grab a pair of wearable gloves that are washable. If you can get them from like a sports store or online, if you can't find gloves, get yourself a couple of pairs and then basically wash them. And then you'll always have a clean pair of gloves that are washable. And they have ones that are, you can even like you be on your phone that has that you can actually, your finger can
Yes.
instill it, right? That's another way to basically do it. And it's really a combination. Like you got sandwich bags, you got disposable gloves, you've got washable gloves, washable mask. I mean,
Yeah.
one of the
But
first, yeah,
but there's one issue with washable gloves too.
which
So
is,
because if you go and keep the same gloves and just go do everything, let's go, you touch all of this stuff, and go to the grocery store, the gas pump, and you don't wash the gloves. You go touch the gas pump, and then you go to the wheel and then start driving all the stuff. Take out the gloves inside the car, but you already touched the wheel.
yeah, but
You already touched all the stuff.
it's the same thing with disposable gloves too, Freddie. What I do is literally, I have wipes, and when I am wearing the gloves, if I walk to something, and I come back to the car, I literally wipe the gloves, wipe the
Exactly.
steering wheel,
Yes.
so it doesn't take away from the fact that you have to maintain another layer. But it's a
Okay.
protection
Yeah.
between your skin and whatever it is at the time that you're in there. But it's not. It doesn't mean you can take off the gloves at home and basically, that door handle that you open. So you have to start thinking in that sequence
Yeah.
and see
Every
what's.
time, exactly. Every time you touch something, you gotta clean yourself up. You gotta disinfect the gloves because you can transfer. It's cross contamination. Same thing if you're cooking. It's the same thing. Cross contamination. So just think about that. That's
I'm
basically.
I'm smiling because of the cooking, because Freddie also, as part of his encouragement and support, also does some of these like meal videos about what he's cooking. and
No,
and
I just did it twice, but everybody wants me to do
yeah,
them, so I
yeah,
guess I'm
what the
gonna
heck,
start
we need some more Freddie menu items. I mean, I need some inspiration.
Well,
But
for me, actually, for cooking, just quick. I don't follow recipes. I just go open the fridge and whatever I have, I make a meal out of it. So that's how.
me too. We call it guerrilla cooking, which whatever you got in the house.
Exactly.
Yeah.
All
So,
right.
well, I'll tell you what, buddy. I think what I'm sounding like is we may have to do a throwdown. We might have to do a video side by side, cooking throwdown maybe.
Let's see who. Okay, sounds good.
Hey,
Then
listen,
we need to have some judges too to see who's. And I'm just kidding.
well,
No, I'm sure
no,
your
no,
food
no.
is much better than
Why not? We can open it up for judging, like whether it's real time live or not. That's the only question we have to figure out. But we got time on our hand. Listen, we all are dealing with this in our own way, right? And
yeah.
I really appreciate people that are in a position where they are caring for others. And that's why I asked you, because I understand, sometimes we forget that in the course of caregivers, that they're caring for others, that it's
Hmm.
also the caregiver that has an
Yes.
impact,
Oh,
right?
definitely. Yes.
Whether it is exposure to COVID right now or just emotional impact. Like, that's why I asked you how you're holding up. And yeah, I know you do different things, like you have your art, you have your cooking, you have things like that that help you kind of maintain a balance. But it's something that we should never forget when it comes to people, whether it be nurses, doctors, caregivers, that are out there. Those people right now are really heroes because they're doing what needs to be
Oh,
done.
yes.
But at the same time, they also bring back with them some sort of emotional cost, potential exposure to the virus, and we should never forget that. Really,
But not only the exposure, like the risk that they're taking to contaminate themselves and at the same time pass it to the family, but emotional, like you mentioned, emotionally, that's the part that is very draining.
yeah.
And because they're working 10 to 12-hour shifts straight or whichever, and then when they get home, they see all of these people suffering. So even no matter how, well, what I see in the hospitals, the first person that is always dealing with the clients is the CNA,
Hmm.
the caregiver of the hospital, then the nurses, and then after that, the doctors. So there's different layers, different levels of people that are dealing with these clients. And then, yes, for me, same thing, going back to caregivers, we get attached to our clients.
Hmm.
We get to know them. We get to know what they need, what they like, and everything. And then when something happens to them, it really affects us. Even
Hmm.
though we are professionals, but still, it does. So we have to find a balance, to do something outside to make sure that we keep a balance in our lives.
Well, I appreciate you, my friend. Always keep doing the good work that you've been always doing. I will check in with you regularly to find out what's going on. But please take care of yourself because you're also out there being exposed. So just
Well,
be.
same to you as well too. So, all right, have a great day.
Thanks, Freddie. Be well.
All right, thank you.
Talk to you soon. Bye
Bye bye.
bye.